Can you imagine standing up when you're a president saying, it's not my responsibility? I take no responsibility. It's not, I mean, literally. Literally.
Those words didn't come out of our mouths while we were in office.
I don't understand his inability to get a sense of what people are going through. He just can't relate in any way.
Well, and one of the things that I have always known about you, Joe, it's the reason why I wanted you to be my vice president and the reason why you were so effective. It all starts with being able to relate. If you can sit down with a family and see your own family in them and the struggles that you've gone through or your parents went through or your kids are going through, if you can connect those struggles to somebody else's struggles, then you're going to work hard for them. And that's always what's motivated you to get into public service. When we came into office, even before inauguration, we had seen a historic financial crisis. Irresponsibility on Wall Street had spread out to Main Street. You know, we had to move fast, not just in 100 days. We had to move in the first month to get the Recovery Act passed. We're now in a situation where not only we've got an economic crisis, but we also have a public health crisis to boot. Tell me a little bit about how you're seeing the current economic crisis and how you're thinking about the economy right now.
Well, Mr. President, there's three pieces that I see. One, we have got to sustain and keep people from going under forever. There's already 10,000 businesses that are not likely to open again, a significant number of small business and minority businesses.
Right.
Number two, when they're able to come back, they not only are able to keep their folks employed on a payroll, but they're able to cover overhead. They're able to cover the additional expenses. For example, the idea you're going to open without social distancing, masks, tests, and all these things,
right,
that costs a lot of money.
Those are added costs for
They're
small
added
businesses.
cost.
Right.
And they should be able to have that added cost to be able to stay open,
right,
for the good of the country. But the next stage of this is going to be, if we're able to, if the stimulus can keep people afloat, then we have to deal with recovery.
Right.
And the recovery is building back, but not just building back, as you've been talking, now I'm talking about, building back better. We have to change the way in which we deal with allowing people an opportunity to make a living.
Right.
That includes child care, that includes making significant investments in infrastructure so people can make not just a living wage, but a union wage, making sure we have build up an entire new public health system, and making sure everybody has health care. And well, now we have a chance. We can add a public option now.
Right.
But this guy's in court in the middle of a pandemic trying to take away the protection for 100 million people who have pre-existing conditions. I don't think he has any sense of empathy. I don't think he can associate at all.
You and I had experience dealing with health crises and public health crises. And in each instance, what you and I understood, and why I have so much confidence that you're going to be able to deal with COVID in the way that other countries with our kinds of resources are dealing with it right now, which is smartly. I have confidence that you're going to actually listen to the experts.
Yeah.
And you're going to pay attention to the science. And you're not going to quit on trying to actually bend down the curve of disease and transmission rates.
When we left office, you had set up a pandemic office within the White House. We had people from the CDC, 44 people in China. We knew pandemic diseases. This wasn't going to be the only one that ever occurred.
And the goal was to create an early warning system around the world.